The federal government will begin shifting children with mild autism off the NDIS. The Health Minister Mark Butler is facing the stark reality of an overstretched system.
The National Disability Insurance Scheme. Its sign is simple, its cost impossible to overlook.
In some areas, 4 out of every 10 in a classroom would be on the NDIS. That was not envisaged that that would occur. Clearly there's a need for a discussion.
The concern I've raised, and I think is the subject of substantial conversation in the community, is the degree to which young children with more mild and moderate levels of developmental delay or autism are on a scheme, frankly, because there's nothing else.
The government is creating a new national scheme to remove children with mild developmental issues or mild autism from the NDIS. It will be called Thriving Kids.
Now, I know this will be hard for some parents to hear, and I don't say it lightly, but we do need, as a matter of urgency, to create a better system that will enable our children to thrive.
This financial year, it's estimated taxpayers will fork out $52 billion for the program. Annual costs are projected to exceed $63 billion by 2029. The NDIS is on track to become the third largest expense in the budget, trailing only health and aged pensions. It supports around 1 in 40 Australians directly.
Bringing growth under control is therefore not just a question of budget sustainability. Social licence is also particularly important to such a scheme. And right now, although that licence is still strong, I do worry that it's coming under pressure.
The scheme was created to provide Australians who have a permanent and significant disability with funding for supports and services. According to new analysis, 7 in 10 people who joined the NDIS in the past year had a primary diagnosis of autism, and most were children. It was recently revealed 16% of 6-year-old boys are on the NDIS.
None of these programs can operate on a set and forget basis. They all require constant vigilance to ensure that they are delivering for Australians who need them.
The states and Commonwealth will co-fund the program. The federal government will contribute an initial $2 billion. Access changes to the NDIS will begin from mid-2027 once Thriving Kids is rolled out. Ruben Spargo, Sky News, Canberra.